friends I used to play. Never hungry, never tired, always free. Nana's cooking filled the air. Lots of love was everywhere in that old tin house by the sea. Every day when chores were done, thought that said, go have your fun. Had to be back for the pigs we had to feed. How I wish that I could see. Thought that Nonna smiling at me in that old tin house by the sea. And I remember the old days when the church bells used to ring and the villagers would gather to pray. How they live life simply, always rich with no money in that old tin house by the sea. Every day when chores were done, thought I said, go have your fun. Had to be back for the pigs we had to feed. How I wish that I could see. Thought that Nonna smiling at me in that old tin house by the sea. Thought that English was not so good, but somehow we understood. And there was Nonna standing by our side. When we did wrong, how we would scold, but we did just as we're told in that old tin house by the sea. And every day when chores were done, thought they said, go have your fun. Had to be back for the pigs we had to feed. How I wish that I could see. Thought that Nonna smiling at me in that old tin house by the sea. In that old tin house by the sea. In that old tin house by the sea. It's up to you what you wanna do in this lonely summer night. Just make sure that it's worth the while and that it feels alright. Oh, good vibes, so won't you fly, oh fly over me, maybe. So won't you fly, oh fly over me, maybe. It's alright, everything will be okay when the sunrise dark turns to light. Even when nothing is going your way, when the sun sets, don't get upset. So won't you
like longer than forever, yeah. My home is now a distant land. If I had one wish, I wish I could be back on the rock in the middle of the sea. My heart is calling me to the islands, blue skies and tropical breeze. I wanna go back home to swim in that Pacific Sea. You can take the boy from the island, but not the island from the boy. 'Cause the island stays in your heart, and I'll never forget where I'm from. Oh no, I'll never forget. No, I'll never forget. I miss the local grind, you know what I mean. Red rice, barbecue, and yes, finna de need. Fiesta, pay for lunch, ooh, what a winner. Call my tellers up, hey, who go buy dinner? My heart is calling me to the islands, blue skies and tropical breeze. I wanna go back home to swim in that Pacific Sea. You can take the boy from the island, but not the island from the boy. 'Cause the island stays in your heart, and I'll never forget where I'm from. Oh no, I'll never forget. No, I'll never forget. Coming in from the island, yes, the island where I'm from. Love the local girls, especially the ones from Guam. Kicking back when just relax. You know what kind I mean. 'Cause when I leave this island, I'll be sorry that I left you. And I will never forget you. Oh no. Oh no. Singing, don't worry about a thing. 'Cause every little thing is gonna be alright. Singing, don't worry about a thing. 'Cause every little thing is gonna be alright. Rise up this morning, smile with the rising sun. 3 little birds pitched by my doorstep, singing sweet songs of melodies pure and true. 'Cause every little thing is gonna be alright. Singing, don't worry about a thing. 'Cause every little thing is gonna be alright. Rise up this morning, smiled with the rising sun. 3 little birds pitched by my doorstep, singing sweet songs of melodies pure and true. Singing, this is my message to you. Singing, don't worry about a thing. 'Cause every little thing is gonna be alright. Singing, don't worry about a thing. 'Cause every little thing is gonna be alright.
When I first saw you, girl, you put a big smile on my face. Then I said to myself, how beautiful you are.
just trying to.
Recording in progress.
Half a day, and welcome to the U.S. Army Corps of Engineers meeting hosted by the Office of Congressman Michael Nicholas. Thank you for joining us. Ladies and gentlemen, Guam's representative to the U.S. Congress, Congressman Michael Nicholas.
I can't hear. You're on mute.
Half a day. Someone's having technical difficulties. Can you hear me now?
I cannot hear.
Who cannot hear?
I cannot hear anybody speak.
Can anybody else? Can anybody hear me?
Yes.
Yes, sir.
Okay.
Yep, hear you fine.
I can hear her loud and clear.
I cannot hear.
I
Yes.
can hear, so it may be on
Loud
this
and
side.
clear.
We'll get
Okay.
you some technical assistance.
All righty. I'll probably join you then.
Okay.
Okay, let me come over and join you.
Okay, we'll go ahead and pause for the hospital administrator.
Hello, can you hear us?
Hello.
I can hear just fine. How about on your end?
We can hear you now. Yes,
Okay,
thank you.
very good. Very good. We'll go ahead and begin then. Half a day and good afternoon, and thank you all for making time to join us. I'd like to begin by recognizing the Speaker of Legislatura, Speaker Therese Terlahi, and the Senators of Legislatura, particularly Minority Leader Chris Duenas. Thank you so much for both of your leadership today and for being present. I understand that Legislatura is debating the budget, and so I know that it's a very important time for you, and we appreciate you taking time out of your busy schedules to make time for today. I think that what you'll find in the presentation is very relevant to the nature of your budget conversations. And so I'm very fortunate on our end, at least, that we're having this meeting in a timely fashion for you to be able to consider the facts that are presented in your deliberations. The Army Corps of Engineers was very gracious to receive the congressional office in mid-July. And in our meeting with them, we had a very, very good discussion about the Guam Memorial Hospital and about the intentions of our island to be able to go forward and move a hospital slash healthcare campus forward so that we can finally close that gap with our community. In our conversation of Army Corps, we asked some very pertinent questions. Particularly, we wanted specifics on where the $740 million figure came from and how that was derived. We wanted specifics as to what that would actually render for us if we were to expense that amount as they were recommending in that initial assessment. And we wanted to get some answers as to how they can help us actually achieve our goal as leaders in this community to be able to put together a state-of-the-art modern healthcare facility that not only would remedy the challenges we're currently facing under our present system of care, but actually do so in a long-term manner that would do justice to us taking out long-term debt for something like this. And so we're joined today by the illustrious Colonel Marshall, who is the district commander of the Army Corps of Engineers based out of Honolulu. And with that, I know that the members present are not here to listen to me. We're here to listen to him and to ask him questions. I'd just like to close by thanking our community partners. I know the Guam Chamber is on the call, and I would also like to thank our media partners for making themselves and their listening audiences available. I do understand that this is also being live streamed on some of their platforms. And so the program today, of course, will have me do my opening remarks. We'll turn it over to Colonel Marshall for his. We'll have them speak specifically about what they are able to talk to with respect to the healthcare planning that they're able to provide. And then we're going to open up a Q&A for our attendees. We will first, of course, like to start with Legislatura and afford them the full respect for that. And then afterwards, we'll open up to our community partners and then to our media partners. And so with that, Tinalta, let me turn it back to you for introduction of Colonel Marshall.
Thank you very much, Congressman Nicholas, for your opening remarks. To recognize the U.S. Army Corps of Engineers members joining us today, we have with us Rhiannon L. Kucharski, Chief Civil and Public Works Branch Legislative Liaison, Don Schlack, Program Manager for Interagencies and International Support Services, and last but definitely not least, Lieutenant Colonel Eric Marshall. Lieutenant Colonel Marshall became the 72nd Honolulu District Commander June 24th, 2020. Prior to joining Honolulu District, he most recently served as the Deputy Commanding Officer of the 130th Engineer Brigade, Schofield Barracks in Honolulu, Hawaii. Lieutenant Colonel Marshall grew up in Greensboro, North Carolina. He was commissioned into the U.S. Army as an engineer in 2002, following graduation from the U.S. Air Force Academy with a Bachelor of Science degree in physics. He began his Army career as platoon leader for the 86th Dive Team, Fort Eustis, Virginia, and deployed as a dive detachment commander in support of Operation Iraqi Freedom from 2004 to 2005. He served as an emergency operations manager and later project manager for New Orleans District, U.S. Army Corps of Engineers after Hurricane Katrina devastated Southeast Louisiana in 2005. In 2007, he deployed to Afghanistan as the Guardis Office Resident Engineer, Afghanistan Engineer District, managing strategic construction in Pakita, in Paktika, and Khost provinces. Lieutenant Colonel Marshall commanded B-148th Infantry Regiment, Fort Leonard Wood, Missouri, from 2009 to 2010. He graduated from the Massachusetts Institute of Technology in 2012 with a Master of Science degree in nuclear engineering. Lieutenant Colonel Marshall's primary awards include the Bronze Star Medal, Defense Meritorious Service Medal, Meritorious Service Medal, and Joint Service Commendation Medal. He also earned the Ranger Tab, Jungle Tab, Dive Officer Badge, Parachutist Badge, and U.S. Air Force Freefall Badge. He is a licensed professional engineer, civil, project management professional, and an assistant professor of physics. Lieutenant Colonel Marshall is married and has 3 children. And ladies and gentlemen, it is my extreme honor and privilege to introduce Lieutenant Colonel Eric Marshall. Lieutenant, you are recognized.
Thank you. Appreciate that. And ladies and gentlemen, I want to tell you how much of an honor it is to me to be able to talk to you today about what we can possibly provide in support of your requirement for a new hospital here in Guam. I'm a little bit bashful from that long introduction, so apologize. But one of my most proudest moments was being assigned commander for Honolulu District. It's really a culminating assignment for me for all that 19 years prior. But since that time, I have not been able to travel out to Guam, and that's been an enormous handicap for my command. We never took our eyes off that radar, not one bit. We've always been concerned during the past 2020, with the travel restrictions about our important partners out in the Pacific islands, Guam being one of the most important. And but I haven't been able to be here. Nevertheless, we've been aware of the Guam Memorial Hospital because of an assessment that was done in 2019 into its state of disrepair. And we were asked at that time to assess it and see what kind of repairs were necessary to bring it back up to code, and then compare those costs with just the cost of building one brand new, just like it someplace else. So anyways, that assessment was done prior to my taking command, and when I took command in June of last year, almost soon thereafter, we were engaged by the governor of Guam about that assessment, and we've been waiting on bated breath for the chance to travel and see it again. In October of 2020, with the rise of COVID, we received a request from FEMA to do what we call an alternate care facility, to do a little bit of an upgrade into the HVAC and electrical in Guam Memorial Hospital. And at that time, I was receiving daily reports from the folks here in the field, even though I couldn't be here myself, and I became very familiar with some of the kind of the layout of the hospital and how important it was to the people of Guam. And so I was very excited in about June of this year, I think, when the Congressman's office contacted us to see if we could host him and discuss this further. So that's what brings us today. I was actually planning travels out to Guam anyway, as soon as the opportunity arose, and then we were able to kind of converge a lot of those travel plans in order to kind of do a deep dive into the hospital. So again, just thank you for your time and chance to speak to you about what I know about the hospital and how we could possibly contribute from the Corps of Engineers. And please believe me when I say that I'm fully committed, from the Honolulu district is fully committed to our partners here in the Pacific, including Guam. So we like to say that we solve the nation's toughest challenges in the Indo-Pacific, or we engineer solutions for the nation's toughest challenges in the Indo-Pacific. A lot of our program areas you might be familiar with: military programs, civil works. Here, Rhiannon Kucharski, who will be speaking to you, she's the chief of our civil works branch. And so she handles a lot of like water resources and studies and flood risk management, things of that nature. That's civil works, and we're here doing a lot of that work already in Guam. Another important here in Guam, the important program to me is our environmental program, where we do remediation and clearance work, our NEPA support. So that also is going on here in Guam and the Marianas Islands. But one of our biggest, more kind of exciting program areas is what we call interagency or international support, or IIS. You might hear us use that term. And that's a suite of authorities under the federal government that allows the Corps of Engineers to do work directly for other federal agencies, as well as other governments, so state and local governments. And there are certain criteria under which we can do this work. But as we think about Guam Memorial Hospital and a new hospital in Guam, that is the authority or the program area that the Corps of Engineers would support you under IIS. And so Rhiannon will talk a little bit more about that here in a moment. What Congressman San Nicolas graciously asked me to speak about was the charrette. This was an idea that we kind of came to him with when he spoke to us about the need for, taking the plan that was already in place for a new hospital and taking it to the next level. So a charrette is an odd term. It's an engineering term. Really, it's a planning process is what it is. It's a fairly low level of design that is intended to corral all of the many stakeholders that are involved in a very complicated engineering project. Oftentimes, in a project the size of a hospital, there are a lot of stakeholders, and they might even have competing initiatives or competing ideas about what needs to be done. They might not be able to always see the entire picture. If you think about an elephant, you may have heard the analogy, taking one bite out of the elephant at a time. They can see one side of the elephant, but they can't see the other side of the elephant. So the charrette is intended to allow all stakeholders to see the full picture, and then also to keep constraints in mind, such as funding and timelines, which are not easy always to figure out if you want a multi-phase project or if you have a lot of different funding streams to pay for a very expensive project like a hospital. So the charrette is a great planning tool for bringing all those folks together. And so I really do think in the Corps of Engineers, one thing that we do really well, I'd even say that the Corps is best in show at is planning. Because that's something we are an unbiased arbiter. We tend to have that kind of credibility that we're not going to come in with an agenda, and that we can bring multiple stakeholders together to try to find what is the optimum solution given the constraints at hand. And so at this stage, from what I understand about the hospital, I think that's exactly what is needed. Before I turn it over to some of the experts here to talk in more detail, I want to acknowledge that a lot of work has already gone into this hospital. I did have a privilege to meet with Lillian and her entire hospital team yesterday, all of her directors. Members of the state government were also in that meeting, and they, for instance, Department of Public Works and Department of Land Management. And these leaders have been teaming up as a task force to put together what sounds like a really good plan so far. I do not want to suggest that the Corps would come in and do anything better necessarily than what they have already done, but rather consider it as like maybe if they in a football term, like they moved it to the ball to the halfway point, we could help them take it all the way to the end zone, maybe with a little added rigor. As I was saying before, like we bring in multiple stakeholders, so we can bring added rigor from a technical perspective. We can bring in the full strength of the 35,000 person, Army Corps of Engineers, take the best of the best to like kind of weigh into this project. We have a medical engineering center of expertise that we would leverage. And we also are really good at reaching out to the federal family. So the Department of Veterans Affairs, the Department of Defense Health Agency, the DoD itself. There could be a number of other stakeholders that are involved here. Department of Health and Human Services. We would reach out to all of them to bring them in to make sure your hospital is adequate from all their perspectives, as well as meet your goals. So I think that's how we could help that task force that has already started take this to the next level through a charrette. And I'm sure you have lots of questions about what this charrette would actually entail, but if I could, I think I'd like to turn, because I received a few questions already, and I thought I would turn it to Don Schlack, who was part of the first team to assess the hospital, and he could give an overview of what that assessment was, what it concluded, and why we might have a business case for the new hospital.
Sure. Hey, thank you, sir. My name is Don Schlack. I'm a program manager at the Honolulu district. And when we brought the team out, a team of medical experts out to look at the facility back in 2019, what we found was that the hospital staff that are working there, extremely competent, extremely dedicated, but they're working with an old hospital, and they're having all the problems that you get with an old facility. So I just wanted to start off right off the bat that the problems of GMH are not a result of incompetence of any sort. This is what happens when you have a 40 or 50-year-old hospital. It was built for one purpose, and with one vision in mind. The way that healthcare has changed is dramatic, and just keeping up with the facility with the current way that healthcare is delivered is a great big challenge. So when they went through and they looked at the facility, some things they could see were easy to see that were issues. Other things like structural would take a lot of drilling and testing and things like that. And so there's some things they couldn't see, and had to make assumptions about, is it likely going to fail? Is it not likely not going to fail? And all that was detailed in the report that we wrote. In developing the cost estimate, I think there's been a lot of concern and discussion about the cost estimate. But the way that we did that is, rather than try and project what we might need, because like Colonel Marshall was saying, it takes a lot of effort to determine the focus of the hospital in the future. What is going to be delivered on the hospital, and what might be moved off campus? What are we going to be planning for 9 labor and delivery rooms or 20 labor and delivery rooms? It all depends on the demographics and the needs and where things are going. So in coming up with just something for people to be able to get an idea about what the what kind of range of costs would be, what we said is, if this particular hospital was 1-for-1, exact same square feet and the same functions going on, was repaired, it would cost, the estimate was I think $765 million. And that's driven by the fact that have to move people out of parts of the hospital while they're working on it. And there's swing space, there's lots of challenges. And we found that a new hospital, exact same square footage, would actually probably cost less, because it would be done on if a new site were available, it would be done on a new site, and the infrastructure could be laid down cleanly. You wouldn't have to be working around patients and healthcare as it's going on. It's something that can happen a lot faster and somewhat cheaper. So in working through that, we just wanted to kind of give you an idea about if it was 1-for-1, what the cost would be. But like the Colonel said, you don't want to do 1-for-1. What you want to do is you want to plan for the future, and you want to build a hospital for the future. Other questions that, well, I'll pause there.
No.
No.
Oh, shucks.
Oh, I can't tell you which.
Team, did we lose the Army Corps? Can we have our staff on site check their connection? You're on mute, Tenoto?
Yes, sir. We're going to go ahead and double check with them now. One moment, please. Thank you so much.
Disconnect. Well, just there in the interim. Okay, there they are. Let me go ahead and pause. They're under Eric Oz, captain of my staff, who has a backup unit in place. So Eric Oz, captain, is the screen of the Army Corps presentation. We'll go ahead and allow you to continue. Thank you.
Okay, very sorry about the technical problem there. No, that was the end of Don's brief. And so basically we've covered maybe my overview and the assessment of the existing GMH to some like high level. I think it's a good place to pause before we go into maybe a little bit more detail about what a charrette could bring you, and maybe sources of funding or a process by which you could now enter into business with the Corps of Engineers. Is there any questions?
Thank you so much, Colonel. And if anybody in Legislatura has any questions, please indicate with the raise your hand icon. That will help us to organize taking in the questions. And just to recap, so there's some clarity. Just to recap, so there's some clarity. The assessment that was done in 2019 was just to replace the existing hospital. It does not increase bed capacity. It does not increase modality capacity. And it does not factor in projected community needs and growth over the next 30-year period. It also does not factor in the interconnectivity between behavioral health and public health that is part of the considerations of a healthcare campus. The charrette that the Army Corps Colonel is referring to will actually be able to take that initial assessment to the next level and help us to project out 30-year needs, modality needs, bed capacity needs, and interagency facilitation. And so with that, Tenelta, if we have anyone with questions, I'll go ahead and yield to you so that you can moderate the order of the questions.
Thank you very much, Congressman. I believe the first hand we had up was Senator Tony Yatta.
I thank you, Congressman. It was the Minority Leader, Senator Duenas, that has a question for them. Thank you.
Thank you very much, Congressman, and to the Army Corps. The discussion on a charrette, how does that interface with architect and engineering plans? Is this a kind of a precursor to that, or is it a tandem effort?
Great question. It is definitely a precursor. So we would have architects and civil engineers and structural engineers as part of the charrette. However, this would not be a design. This is a charrette. An output of charrette would give you the scope. It's really a lengthy process to determine exactly what scope of a hospital you want to design for. And so there will not be at the output of some plans and specifications. I think at most, what we might say in the engineer field is you have a 10% design at the end of a charrette. But it's not construction plans. It is only, it's only basically a good scope.
So what I'm hearing then, it kind of complements what the current task force is doing, maybe a 30,000 foot view, and basically kind of like gives that overall possibility of some tech support.
Yeah, and if I can go into a little bit more detail, sir, about what the team has done so far and how I feel like the charrette would take you one step further. We were discussing how they were forecasting demographics for, let's say, the number of rooms that might need for acute care. Well, they were forecasting 5 years into the future. A charrette would probably forecast 50 years into the future and try to use best practices throughout our, kind of the field of medical planning to determine what would be the right factors to use 50 years in the future, based on what we know about Guam today. Another thing is that the charrette would help you phase your construction or your design. So, Rhiannon, who I'm going to give a chance to speak, likes to talk about how you sometimes might want a Maserati, but you're pretty happy with a Honda Accord too, right? And so if you don't have the funds for the Maserati, you might want to be able to adapt for that, but phase in the Maserati while you buy the Honda Accord first. So it allows you, the charrette would allow you to kind of take in the constraints of your funding and phase the design and construction according to the funds that are available and where you'd like to go. A third thing that the charrette would do that I think the current team doesn't yet have the assets or resources to do is consider resiliency and redundancy. When I speak of redundancy, I'm speaking of utilities, that make sure that you have plenty of backup power and that you have water and sewer and telecom and all those things, but redundant to the point where you're planning for things that you don't know could happen in the future. Right now, I think they're planning for what they know. I think our charrette would help you plan for things that you don't know. And then these are options that you would consider going forward with, or you would not, because maybe the funds aren't there to invest, or it's just not something within your risk threshold. Resiliency, we talk about the effects of climate change and other things in the future that we can't predict and how that could affect your facilities. So basically, through that one, I'm describing that in a charrette, we look at the entire life cycle costs of your hospital campus, not just the initial construction, but phased construction onto operation and maintenance is what a charrette would help you think through. And then lastly, it might seem obvious, but the end of a charrette, you have a scope that you believe in, and you have a credible budgetary estimate. Something that you can truly take to maybe your funding sources and say, this is what we need for phase 1, phase 2, phase 3. And again, we consider the different colors of money that you might have through different grants or sources, to go into those phases.
Excellent, thank you.
Thank you, Minority Leader Duenas. We are going to now proceed in the order in which questions were received. I'd like to recognize Senator Amanda Shelton for your question. You are recognized.
Thank you very much, Tanelta Hafide Sijus Masi, Congressman, for facilitating this meeting. Thank you very much, Lieutenant Colonel Marshall, for the introduction. I have a question regarding Rural Emergency Hospital designation, and I understand that this new designation has been authorized by the Consolidated Appropriations Act of 2021, which will become effective in 2023. And I'm wondering if there has been any discussion between you folks and our hospital and perhaps the Guam Department of Public Health and Social Services regarding creating a new facility here, or maybe transforming the current facilities such as the Southern Region Community Health Center or the Northern Region Health Center into a rural emergency hospital that can help supplement the new GMH if we're going to go by the same footprint. And these hospitals, just for those who are on the line, these are hospitals that will provide emergency services and observation services. And they have the possibility of receiving higher rates of payment from Medicare for outpatient perspective payment system. And so I think that this could be a great opportunity for Guam to look at. I'm just wondering if this is something that you're already discussing and considering as an option for us.
Ma'am, I'm not. Thank you for the question. We're just kind of, as you were talking, I was seeing with my team. We actually haven't heard of that either. But that is precisely the kind of thing that I think when you give the time through a planning charrette to flesh out, I think those alternate sources of money or policies that could be beneficial to your project will be considered. And so I took good notes. I'm going to look into it more, but I don't have any details on how this hospital could benefit from that policy.
I appreciate the consideration that you'll keep it in mind.
Thank you very much, Senator Shelton. At this time, recognizing Senator Mary Torres.
Thank you, Snelta. Thank you, Congressman, and Colonel Marshall. The question that I had, there was a comment about planning for the needs, the future needs of the island. And I was just wondering who exactly will take the lead or should take the lead in understanding what the organic growth of Guam would be in the future in terms of what the hospital needs would be, and also what the military footprint on Guam will be for the next few decades to come. So is that something that is incorporated into the charrette, or is that an exercise that is born locally in terms of planning? Because we do have already contemplated a healthcare facility, and I don't know that the footprint has incorporated all those things into the study. So how exactly would we proceed with that, in your opinion?
Thanks for the question. And I was impressed when I met some of the task force members at the hospital working under Lillian, hospital administrator, that they had done some thought along those lines, ma'am. But I think the charrette can go a bit farther. I think Don knows how it might work.
Yeah, thank you, ma'am. The way that the Army does it, which is the way that we're familiar with, even before the charrette, that kind of data is gathered, and that becomes the starting point for the charrette. So reaching out and gathering from any source, what are the demographics? What are the sources of patient funding? What are all that is brought to the table at the beginning of the charrette. So it can be done either locally, or it could be done by hiring being the first part of a charrette, where the contractor would go out, gather that information, and then bring it to the table at the time of when everybody is involved. Does that answer your question, ma'am?
It does, but I think the component that I'm concerned about that we don't have a handle on, that only the federal government does, is what is the military footprint going to be? Because we are aware that a lot of the specialized care right now, take maternal care, for example, labor and delivery, a lot of that population trickles over to the local hospitals. And that, for example, is one example, is something that we can consider. So that's nothing that we can predict. We can estimate organic growth. We can estimate what our healthcare needs will be, assuming that we have better healthcare, preventative healthcare, what it may be in the next, say, 10, 15, 20 years. But the military is the uncontrolled factor here, and I think that only you can provide that.
Concur. I think that's a concern on on the task force minds too, ma'am. We had in the room yesterday, we had the state liaison to the DoD, and she mentioned how she has her own kind of committee looking into that. Because, you know, with the new military units coming to Guam, that brings not only the service members themselves and their dependents, but also staff. And so that will absolutely affect the demographics here. And another factor there that we have to go back and research ourselves is, you know, the DoD Health Agency, or DHA, is transforming. And so how DHA takes on what used to be just maybe an Army or a naval, you know, medical service is different than it was under the services. So anyways, all of that is very much dynamic, and it's under a transformation mode right now, and it has to be looked at as we look into a new hospital.
Thank you. I'll allow for the others to ask questions. I'm sure we're all thinking along the same lines. Thank you, Congressman.
Thank you so much, Senator. Just to quickly interrupt, I did get an inquiry from our speaker if we can go ahead and continue with the Army Corps presentation so we can get that completely out of the way. I do know Senator Brown has her hand up, and Senator Appropriations Chair Senator San Augustine. Madam Speaker, they've already raised their hands. I don't want them to lose their questions, so we'll go ahead and get to Senator Brown and Senator San Augustine, and then after Senator San Augustine, we will pause to allow Army Corps to conclude, and then we'll resume questions from the legislatura. Senator Brown, please.
Thank you very much, Congressman Nicholas, and certainly thank you as well to Lieutenant Colonel Marshall for providing us this opportunity to be able to engage with you in your presentation today. We're in a very interesting position here in the Guam legislature because we're dealing with the Budget Act, as the Congressman had mentioned, and we're being asked to put money aside and fund a new hospital. I think you'll find a consensus among all of us that we certainly understand the need to build a new facility, but we're also being asked to do so in the blind. I mean, most of us don't even have any specifics with regards to the size of the hospital that we're looking at, the bed capacity, the level of service, in terms of what type of specialties, for example, are going to be provided. So certainly the idea that you're bringing forth that you know, these concepts can be put together and presentations can be made, perhaps even in phases, because certainly initially we may not be able to afford everything we need, and we might not need it all within the next 10, 20 years. But may be able to need to expand beyond that. So I think it's a very good idea. But how can we get more information through this process, the charrette process that you're talking about, so that we're not making decisions in the blind? Because there are limits to finances. No matter how much money we always have available, there's always limits to how much can we afford. And of course, we want to be able to let our people know that in moving forward, this is what they're going to get. This is the capacity and capability of healthcare and quality of healthcare that we're going to receive, even though we keep hearing that the title of this facility, you know, it's going to be a center of excellence. And it sounds like a very nice title, but we want to know what is going to be put in the actual brick and mortar of construction. What's that cost? And then what's it going to cost to put the equipment? What's it going to cost to put the staff and specialty? Because we're already getting information right now at our current hospitals, not even able to provide certain medicines in stock that are needed from our community. So I wanted to know if you can elaborate on that a bit, on how we perhaps, before we even venture down to just say, oh yes, we're giving a green light, because again, there's no argument about the need for a new hospital, but we want to get a better picture of what exactly it is that we're venturing down. I mean, it's like buying a new car sight unseen and never taking a test drive to know what it is we're getting. And I don't like spending money in that manner, even if it's something that we critically need.
Yes, ma'am. Okay, I'm gonna turn it to Rhiannon Kucharski, who's got a lot of experience in planning, and through the planning process, kind of gives stakeholders the credit, the confidence along the way. I think it's exactly what you're going for. One point of clarification: when I mentioned center of expertise, I'm speaking of within the Corps of Engineers. We have a medical engineering center of expertise. And it's kind of a maybe a think tank, you might consider it, that we pull from for the depth of this type of engineering. So anyways, Rhiannon, could you help her out?
Tanner and I are sharing audio, so you may see him and hear me, but you can toggle in your videos and look for the redhead, and that's me. So I'm waving. It's certainly very nice to meet you all on video. So I want to help sort of explain what the process is like to do a planning charrette and exactly what the value proposition is. So when the Corps, for example, kicks off any project, one of the first things we invest in is a planning charrette. So we convene everyone who needs to have a voice, everyone who may have to provide a permit or consider mitigation or impacts or needs to have a voice in determining what is appropriate for that project. You know, we need to define the problems, the purpose, the need. And the Corps, one of the things we do is we look at not just the problems and the needs and the opportunities of the present, but we're very forward looking. And so our policies tell us we need to look out 50 years into the future in terms of things that we plan. And so when we convene a charrette, it could be up to say 100 people coming together, facilitated by a professional or sometimes more than one professional in a very organized sequence of events where we really go through and try to determine and come to common understanding of what we're doing, what is needed, what the challenges are, and how we want to get to our vision of success. And so we're not going to answer all questions at the end of a charrette. Normally we spend a business week together. And so what we hope to come out with is sort of the essential elements to scope the project. And so our investment decisions typically come at the end of the planning phase in terms of which alternative we've selected, right? Are we going for the Honda? Or can we really afford and want the Maserati? Or maybe something in between, you know, maybe we're getting a Tesla, who knows? But the point is that planning, that phase of planning is so passionate to me. That's why I am a water resource certified planner and a planner with the Corps is really important so that you know that the investment that you're going to make is going to be worth it and is going to return benefits, right? I'm an economist by training, so I want to know that for every dollar we put in, we're going to get more than $1 back in benefits. And so I hear you when you say you want to know what you're investing in and what you're approving the budget for. And we follow a very similar process and completely understand with how you feel. And so we want to help you make informed decisions and good decisions, good for the community, good for the medical care of your people, and also economically wise. Does that answer your question?
No, I really appreciate your input because certainly, these are big decisions to make and they're necessary decisions certainly for any and every community, and more importantly for Guam with our current challenges that we have at our Guam Memorial Hospital. But again, I think it would be very good for us, and certainly Congressman, again, I appreciate your efforts in supporting us with this, to have something set up like this for Guam so that not just those of us that are policymakers, but our community can have some insight, an idea and understanding other than just talking about the need for a new facility. What are our options? What are we going to be able to construct? What is phase one, for example? Maybe we don't get everything we need and we might not need it all up front, but maybe we plan over the next 20, 30 years, for example. So that it's also affordable. And it's not just the brick and mortar aspect of it in the construction, but what are we able to, what are the capabilities and capacity that the hospital will be able to provide service for our community? I think those are all very, very important things that we would like to know before we even consider, yes, we're going to put X amount of millions of dollars into this construction, which is kind of like what we're being expected to do at this juncture, without really some of these very big questions being answered, so that our community has some comfort moving forward that they're getting not just a better facility, but they know what they're paying for. And I think that's a reasonable expectation, especially something that would have such a high price tag as a new hospital facility. With that, again, thank you so much. And again, Congressman San Nicolas, thank you for facilitating this process for us. Most appreciated. Thank you.
You're welcome, Senator. Next, we have Senator San Agustin, and I apologize, Speaker, but my staff informed me Senator Taitigui also had her hand up before I interrupted and set a break. So we'll go to Senator San Agustin, and then afterwards, Senator Taitigui. Senator San Agustin.
Hey, thank you, Congressman San Nicolas, for inviting me to this meeting, and for Colonel Marshall, UA, Army all the way. That's what I'm talking about. But Colonel Marshall, I'm retired Army. I'm 26 years, okay? So I understand where you come from when planning. My concern is, you mentioned the charrette I don't know, would it be you folks that would be coordinating this meeting? And if so, you would be, I would assume that you would be coordinating this with the task force that we have on Guam that's set up that you mentioned earlier. And then the other areas I'm concerned about, you mentioned possibly a funding source through other federal agencies. Because, one thing here on Guam, Colonel, is that what we've been informed is that there have been quite a few referrals from the Naval Hospital, and there's been referrals from the private hospital here to the Guam Memorial, to GMAs, to our local hospital. And since you mentioned there may be source of funding through other federal entities, I mean, that'd be great. And then with the meeting, and we come to terms, because like my colleagues will mention that we've identified a bill to introduce to provide $35 million put aside so that we can go through the planning phases. And I know that the meetings that will normally happen, they move, I mean, in the Army, they move fast. We move fast and we hit strong. I believe in that. And I know you think the same way. I heard your background there, Colonel. Was that one shot, one kill, move on? But maybe you can give me a little bit of input on that one, Colonel, on how have you been invited to lead the charade? And that'd be great. I like to see an Army guy lead this stuff.
Well, sir, you're right. In the Army, things move a lot fast. I'll say in the Army Corps of Engineers, we're just running a step slower, but it's because we get it right. Engineering cannot be done very quick. So we do get it right. I have not yet formally been asked to provide this charrette to people of Guam, but I'm happy to do it if the request is formally given. We'll talk a little bit more about how that happens. To answer your question about maybe I think you're thinking org structure and command and control as a good Army officer would, or career Army person would think. I command the Honolulu district, which is considered a geographical district, and the geographical districts do retain command and control over missions like this. I have a fairly small district, about 325 people, and a few of those are skilled in medical engineering or medical programs. So in order to deliver something of this scale and magnitude, I would reach back to that 35,000 person enterprise to bring them into my district to support from afar. That's that medical center of expertise. That's my engineering research and development center. That's my planning community of practice. I've got a lot of different resources to pull from. But at the helm of this project, if you bring the Corps on board, will be a project manager out of the Honolulu district. And that person will report to a chief, and that person will report to me. So that's the nice thing you get from working with the Corps, is that there is a command structure. But as far as sources of money, I think that was another question you had. I'd like to turn it back to Rhiannon, who can talk in more detail about different ways that this can get funded and move forward.
Thank you, sir. Yeah, so in terms of accessing us through the most likely program, which is interagency and international support, typically what that requires under the Chiefs Economy Act is for the government or agency who's requesting our assistance to have at least some other federal funds, at least 15% or more of the overall project. And there can also be local funds. Those could be territory funds or local government funds. It can be a combination of sources. And so the other thing that we do require is a letter of support from the other federal funding agency or agencies saying that working with us for this purpose is an appropriate use of those funds. Another option, if you're not coming to us directly, and we talked about this at the hospital the other day, so some of you who spoke with us then will know what I'm talking about. If you're coming to us through, for example, the Office of Insular Affairs, and we've done a lot of work on Guam at OIA's request, we already have a memorandum of agreement with them. And so they can come to us with a work agreement, which is an easy sub-agreement under that MOA, and say, Corps, we need you to help with this. And that could be with OIA's funds or potentially other funds that they're able to leverage. So there are options, I guess, is the bottom line.
Thank you very much. And then maybe on our end, You know, we got Congressman St. Nicholas. Maybe you can help out on that end, and I'll reach across the street to the governor's office and and the Guam legislature. We'll reach out and let's just come together. It's all for Guam, and it's all for the people of Guam, and it's going to help the military, because as the military is growing, the build up on Guam, it'll help them, because I know they're not going to build another military hospital in Guam. I know that they'll build a bunch of clinics, but that's about all. That's all Uncle Sam does a lot. Build a lot of clinics and then turn it over to whatever hospital is the closest. But I would actually be reaching out to our congressman and to the governor and asking that I'll even prepare the letter to request for the Army Corps of Engineers support, and through whatever agencies we need to coordinate through. And I know that the delegate he wants to get this done. Want to do it right the first time. Thank you, Congressman.
Thank you, Senator San Agustin. And absolutely, if this is something Legislatura wants to move, we will work to find interior funding with our interior partners as well, whatever they're able to provide. And of course, we would communicate with Army Corps for further guidance on traditional funding sources federally that they're aware of that have been tapped in the past. With that, I'd like to yield now to Senator Taitigui so that she can ask her question. Senator.
Sijus Masim, Congressman St. Nicholas, and thank you for putting this together, and most especially Hafaday, Lieutenant Colonel Marshall, and thank you also for participating in this. We greatly appreciate it. I've been I think, an advocate for building a new hospital from the very beginning, and created legislation to create a task force. So I'm greatly appreciate for you. And Renee, thank you so much for spelling the word. We were wondering how to spell charrette, you know. I was about to ask and you read my mind when I saw it on the chat. Charrette. Okay, thank you. So now I'm writing it down correctly. I was doing it S-U-R-E-T, but thank you so much for that. You know, one of the things that was mentioned earlier, I think it included the VA, you know, working with the VA clinic, also the insular areas was part of the conversation with the current task force of the hospital that's put together to discuss that. So you mentioned, Rianne, that 15% on federal funds, and it could come from the insular area. That's really good information to know. So I'll just move on to my next question. What is the timeline with regards to, you know, laying out the final results or the results that coming out of the charrette? What are you looking at as far as timeline that will find the scope that you talked about, you know, and then after that, what's the next step?
All right, I'm gonna give it to Don on this one because he's done something like this. He can give you some more details.
Okay, Don, half a day.
Half a day. The process is such that what we would need to do is we need to get a medically competent architect engineer firm on, and that typically takes 3 to 4 months, and then they are going to be gathering data. Like I said before, the charrette, that would probably take 1 to 2 months, and then the charrette would happen, and then reports would be written and reviewed by everybody. That, you know, these things are not done in secret. So the charrette would be prepared, to be reviewed by everybody. Input would be made, so that whole process would typically take anywhere from 1 to 2 years. To get through all that. Again, there's a lot of back and forth going on to make sure that the outcome of that planning is really accurate. It can be sped up a little bit in some ways, but sometimes the more you push, the more voices aren't heard as well as they should, and you really want to make sure that you get all the input you need, you get all the data that you need.
And thank you, Don, because I think, oh, sure, Renee, go ahead.
I just want to build off of what Don said, because if I didn't know what a charrette really was all about, I'd be thinking, why does a meeting take that long? And so if you're thinking that, we're not just talking about the charrette, we're really talking about the planning phase for the new hospital, right? You want to come out of that phase with a conceptual design, conceptual costs and benefits, and a plan that allows you to move ahead into pre-construction, engineering, and design. So it really is a phase that we're talking about, and the charrette is just the most important kickoff or initiation event that really sets us on a good trajectory for that planning. And then I also want to say that those timelines are from inception when we have funding. So, you know, if it takes us 6 months to get funding, then those timelines would begin at that moment that funds are received. And I hope that clarifies a little bit for you.
Thank you so much for that, Renee. In fact, you're moving right into my next question with regarding to funding and how much funding is going to be needed for this whole project with the Army Corps of Engineers. But before moving into that question, you know, the 1 to 2 years for this to happen, it's quite, I mean, it's a distance, you know, so it looks like we have some time to try to save some money, you know, for this project. What I really appreciate most especially is the modifying and the ability to phase in certain construction. I know you're incorporating being able to look at this in a 50-year timeline on what it's going to be in 50 years. But I think what's important too is to modify the phases to be able to build on later on if it should need additional rooms. I mean, we do have one other hospital on this island that we have to take in consideration, and the populations versus bed capacity is very important. But let's get into the part that you were about to say on the funding of this whole charrette that you mentioned, Renee. You said until you get some funding on this, what are we looking at? Is Army Corps of Engineer going to shoulder this whole 1 to 2 year process?
One other point I wanted to make before I finish with that is the outcome of the charrette and all the planning is really the blueprint for the architect engineer firm which is going to do the full design of the hospital. Once you have a good plan, you're able to get that architect engineer their scope so that they know what to design and what they're going to, and you don't have a lot of churn going back and forth of, well, we wanted to do this, but now we're making changes and we get new input. That churn really can waste a lot of time in medical planning. The costs, the kinds of costs that we look at for this, they need to be adequate. They need to be enough so that we can get the right people involved and the smart people involved that have experience to be able to bring up ideas that may not be obvious to everybody. The fact that, yeah, we need to plan this facility to have adequate space between the ceiling and the next floor, because that's going to be something that's needed for maintenance, because we're going to be changing this hospital. In 10 years' time, wings are going to be gutted and they're going to be replaced with new things, which are going to be state-of-the-art as time goes by. So the bottom line cost that we look at for this kind of planning is tends to be from about 0.2 to about 0.8% of the total estimated amount. Our estimate for this was it would probably be between $2.6 and $2.8 million to do everything from the data gathering up through the end of the charrette and having a scope of work ready for a architect engineer firm to then take and do the design.
So the question is, does the Army Corps of Engineer will shoulder the 2.8 million to do this?
Just to clarify, if I could clarify on that one, Senator, that one we can target federal funding for. We would either partner through a Department of Interior to fund that with federal resources, or we could fund it locally. But I would encourage us to use the available interior grants that we usually get allotted to us every year.
Oh, thank you so much for that, Congressman Nicholas, and I know your office will do as much as you can to try to find that funding to move forward, because it is, say, 1 to 2 years with regards to this whole plan and process. So I don't know what we can do as well to finish off by saying we need to expedite this as soon as possible. I'm sure Lieutenant Colonel Marshall, when you saw the hospital, and it's not just, you know, the fact that it's deteriorating fastly and it's over its long, you know, its lifetime, but it's the most important part is the safety of our patients as well as our employees over at the hospital. That's very, very, very important. So greatly appreciated again, Lieutenant Colonel Marshall, and aloha and hafa day.
Hafa day.
Thank
Ma'am,
you.
I would add that, you know, that is a long time for the charrette, for the planning process, but there's other things. I saw the land that's being proposed for this. You know, that land is going to possibly need to be cleared, you know, or remediated possibly. There could be some NEPA compliance that needs to be started. So the process is long, not just for charrette, but for, you know, getting a site ready to receive a campus, a medical campus. So I think a charrette would be a good way to spend some of that time in parallel with other activities.
With that, Colonel Marshall, you did mention that there was some additional parts of the presentation. Were those already covered in the interim dialogue, or is there additional items?
Sir, I think we've covered it all. I mean, double check, Rhiannon, was there anything you wanted to add?
The only thing I would add to the benefit of our general audience is just that the Corps, unlike a lot of our sister federal agencies, is not a granting agency. So we do not, and we're probably one of the only, if not the only, issue grants. What we do is we partner with local sponsors where we have a federal match and a local match. And in interagency and international support function, we actually work at the request and as the engineer arm for you. And that's cost reimbursable, which is where we use other funds that you use to pay us through another federal agency or through local, state, territorial funds, or even sometimes funds from nonprofit grants. So that is how that program works. Just wanted to clarify that since we're a little bit interesting in comparison to some of our other agencies.
Thank you so much. And next we have Senator Moylan, I believe, had a question.
Thank you, Congressman. Thank you to the panel. Lieutenant Colonel, the last statement you made, which was it here? Well, let me go back to something before then. Has a charrette ever been done previously on Guam?
For a hospital, sir?
Yes. Is there any prior charrettes?
The Army does, or the military does charrettes for all of our large military construction projects. So a charrette was done for the Navy hospital, and it's it's probably done for most of the other large MilCon projects that are out there.
Okay, but not for our local hospital.
That I wouldn't know. I wouldn't know that.
Okay. Don, speaking on the last time you were out here to do the assessment in 2019, so you congratulated our staff and the hard work our current administration is doing at the hospital. From what you have seen with the previous issues, are those all taken care of, or have they been addressed, or are we at a better place than we were before, or there's still a lot of work to get done?
Another part of our assessment, we identified what was estimated to be about $21 million worth of fairly urgent repairs. So that was they needed to be done if the current hospital was repaired or replaced. So there are safety issues. There's other issues which need. I know because I've talked with the Office of Insular Affairs. I know that some grants have been provided to start addressing some of those things. I think a fairly large grant for heating, ventilation, air conditioning. But I don't really know about the rest of the things and where they are. My guess is probably they haven't all been remediated. just because it's been a pretty bad couple of years since 2019 with COVID.
Yeah, I should go visit the hospital. It's been raining for quite some time here, and I'm just wondering if it was still leaking and if you heard anything, but I'll check that out. But thank you. I appreciate the information on the charrette there, Lieutenant Colonel, and as our chairman was saying there, that he'll be inviting or finding exactly how who should be the one to invite you. If an invitation went out today in the proper channels, how soon would the charrette be able to start here?
Sir, if I could sign on a dotted line right now and get started, I would. But I think an answer that Rhiannon gave earlier is probably a good estimate. So we would need funds. Once funds are given in a letter I guess it's a letter of request is provided to my office or to the Office of Insular Affairs with funding sufficient to allow this to begin, we would immediately engage within the Corps of Engineers to acquire that AE firm, the architectural engineer firm that would be the muscle through this charrette. And I think it would take about 3 to 4 months to get that AE firm on board. And then from there, there would be a certain amount of like pre-work and research that was done, and the charrette would probably be scheduled. I don't know if we were going to start this right now, probably early next year is probably when the charrette would actually kick off. If we take into account all that procurement time that has to happen. So I hope is that helpful?
Yeah. So basically, we send you the request. We show you we have the money available, 15%, which we don't know what the 15% is yet, but we're giving you assurance that we shall do this. And then you're saying in about a 6-month time period after you get the letter and the confirmation that we're able to provide this money, that you'll be able to start the process with an architect and a design firm. And then from there, it's a couple of years later after it's all done.
Yeah, it's part of it, and that's a little bit. I'm sorry, it's a little bit fuzzy and vague. We could probably put this in writing a little bit cleaner. But yeah, I think you pretty much got it right. One thing that I wanted to clarify, because this is really important, is that 15%. That what Rhiannon was speaking of there is for us to use the Chiefs Economy Act, which is a way for it to get us involved, working directly for the government of Guam, is that you would need to provide 15% of the total cost through federal funds. The entire, the remaining 85% can come from wherever. It can be a mixed color of money, mixed pot of money, but 15% at least needs to be federal funds, and then you can bring us on board directly.
It can be in-kind
services. And it can be in-kind services, in the ledger as well. That's just one way to get us on board. The other way is you get us on board directly through OIA, fully funded through OIA.
Okay.
I didn't mess up there. I'm checking with my smart guys.
No, I'm sorry. Just a few more questions there. So, nothing fancy. If you go for the Honda, right, you have an idea of our population. You have an idea of what we need to provide for our community, plus or minus so many extra rooms for birthing center and stuff. What's a build out time, from when you're going to cut the ribbon? Yeah. Nothing fancy, just a Honda.
Sir, I don't think I could be so bold as to, give a stab at that. We have so much to learn about the scope of this hospital, of what's actually needed. And considering the phasing idea too, about what is really needed right now versus what we would like to add on later. It's a very vague question for me to answer.
Okay.
But Don, you seem like you have a way to go with that.
For other Army clinics and hospitals that I've done, the time from the end of the charrette until the time it's completed is typically about 5 years.
5 years.
5 years, and I say typical, and it varies from that. But it depends on what all is required. It depends on other extenuating factors. For example, if electricity has to be, if a new substation has to be brought in, that coordination has to happen, and that how things are placed and phased can speed things up or slow things down. But typically we go from the end of the charrette, or sometimes the beginning of the charrette, to completion in about 5 years. Now, that can go wildly astray if there's not good change management. One of the things which is a real challenge for medical is changing so fast. It's not like an apartment building. It's not like a store, but the medical equipment that was mentioned earlier of today is obsolete by 5 years from now. So there have to be decisions made along the way, have to lock in and have to not go back and try and redo something and re-engineer, because that will drive something to way too long. You may have heard of the VA facility in Aurora, Colorado, which that's exactly what happened. They changed from 250 million to 1.2 billion, and at 10 years they still hadn't finished it because they kept changing their mind. So management is important all the way through. Good planning up front and then management through.
Okay, thank you. Just a final question, please. Will the charrette also consider the location of this new hospital, whether it be current or another location based for the best for usage of our community? Is that part of the plan?
Yes, sir. One thing that gives me a little more confidence in being willing to sign up at this point with Governor of Guam on this hospital is that there's a viable land that's available, and or there's a plan for how we can make it available, and that gives me a lot more confidence that we could jump in and be value added. So it's nice to see that the Eagles Field is available, and that's something that we can use as a starting point. To elaborate a little bit further, the charrette will think about what components of your hospital campus needs to be on campus, and what components of your healthcare system can be more distributed. So there might be some things that are currently listed as we would love to have this as part of our health campus, but either doesn't fit, or maybe it's better if it's not on campus, because maybe something like a dialysis center needs to be more in the community, perhaps. I'm no expert on these things, but that's where we bring in the experts who've done public health for their entire life, and will help advise on where is the right place to put different types of care facilities, on campus or off campus.
Thank you very much, Congressman. Thank you so much.
Thank you, Senator Moylan. Minority Whip, Senator Frank Blas, I believe you indicated you had a question, sir.
Yeah, thank you, Congressman, for facilitating. This is a great conversation. Lieutenant Colonel, thank you very much also for being here. Just one simple question. These are great ideas, that are coming up for us to consider. Has this been broached actually by or discussed with the current task force at any given time previous to use the charrette?
Yes, sir. We were fortunate to be able to have a meeting with the task force yesterday. It wasn't a formal task force meeting. We were invited to the hospital to speak to them about what the Corps could provide on this. We spoke about a lot of these same matters, and they seemed, optimistic that we could add value. I was very humbled to the fact that the task force has successfully moved the planning ahead in a positive direction, so that we're not starting from scratch. You to bring us on, and they seem to see the value that we could bring from the point of departure that they are at right now.
Well, maybe more specifically was the idea of the utilization of the charrette broached at any time in 2019?
It's a good question. Not sure, sir.
Stuck. That wasn't really one of the things that we discussed at all. No, we were looking at that facility and were there issues with it or not.
Okay.
In retrospect, it probably would have been helpful to give context, and but that wasn't our focus. One of the other things that we used as a planning, just for comparison, in order to come up with the budget estimate that we did, we worked with, we brought a cost estimator with us who does medical cost estimating, and he's most familiar with the UFC, which is the code that's used for Army facilities and for military facilities. So that's the code that we use. And rather than try and divine what might be applicable here, we just use that for the in development of funding estimate. Now, probably what you will use is the International Building Code, because you don't have to design a military facility. But there's some differences between the UFC, the military, and the civilian one. But they're primarily related to military specific things like force protection, protecting against bombs going off, cyber protection, things like that. A lot of those things you probably won't need. But there's other things that you will need that are not typically part of the UFC, and that's a lot of enhanced corrosion control, a lot of other things to really work with the fact that you are in a very aggressive, corrosive environment that's very hot, very humid all the time. You have high winds, you have some seismic things. So those are gonna, well, you're gonna be saving some money from not having progressive collapse, which is a requirement of the UFC. You're going to probably want to enhance some other things, so you're going to have a facility which lasts for a long time. I know you didn't ask that question, but I answered it. So.
No, I appreciate it, but I think most appreciative of, thank you, Congressman, for allowing this conversation be so, before we put shovel to ground, or money to account. This is a great idea for us to be able to look at. Thank you very much.
Thank you, Senator Blas. And I do believe we have Minority Leader Senator Tony Atta, who has a question. Senator?
So that would be myself, Congressman. Just one real quick follow-up. Lieutenant Colonel and your team, do our federal partners look more favorably, perhaps, on grants and other opportunities having performed a charrette, given the fact that they probably have an idea that this was done and it could bode well for us in terms of our petition to the national government for additional resources?
Yes, sir. And I'm not a fund hound, I don't know exactly how to go about getting the money, but I am confident that in my circles where we deal with very complex projects all the time, a common question is, it's almost an assumption, was there a planning a stage of this? Because if you think you're going to go into just the design without a scoping, a significant amount of time invested into scoping that design, there's no question, as Don pointed out, that you're going to have changes along the way, and it's just going to put the whole program at risk. In my line of work, the question is executability. Can you execute? Is this cost and time believable, credible? And if you don't have a significant amount of time invested in planning to make sure that scope is what all stakeholders in a complex project like a hospital have a chance to help scope and shape, I don't think that fund granting organization would think very highly of your design without knowing that a planning stage was a part of that.
Thank you.
Thank you, Senator Chris Duenas. Senator Pito Terlahi, I believe I see your hand up.
Mike, before I share my thoughts, I just want to thank you for coordinating this, deliberation. And I also want to thank the Colonel for joining us. And let me just say that, as a contractor for the longest time, funding is most important on this type of project. And I just wanted to find out, what are we talking about when we talk about the 15%? Is that 15% federal funds or because I'm not sure. Is that a requirement to get Colonel Marshall to join us in this endeavor? We need 15%, get it from the federal government?
I'm going to turn it to Rhiannon and say it better than me, because I probably stumbled through it the last time. Go ahead, Rhiannon.
All right, I'm going to get all mathy on you now. Are you ready? Okay, so if you came to us under IIS, under the Chiefs Economy Act, and you said, "Core, I have a $100 project that I would like you to help me with," at least 15 of those dollars have to be from some federal source of funding. And the other $85 could be from your checking account, and that would be fine. Or all $100 can be federal dollars, and that's also great. But where we have trouble is if you have no federal money, then we cannot fit under the Chiefs Economy Act. And it does not allow us to do the help that you're asking for. So I hope that helps make it a little bit more clear.
Understood, Renee, understood. Another thing that I wanted to kind of just pass on to everybody is that, you know, when we start a project, a magnitude project like so, you know, the most important thing that we need to consider, not only the cost, but the right people to monitor the project. And that's what we need. And I couldn't agree more with what you had mentioned, Renee, on the things that we need to consider in pursuing this type of project. And I want to thank you very much. Thank you, Colonel. Thank you, Mike. Jesus Mase.
Of course,
Senator, if I
Senator.
could add a small thing to what you just said. We very much agree. Obviously, supervision during the charrette is important in the planning stage, but you know, that's just the first stage really. Then you got design and construction. And it's just my line of work, so I'll give a little sales pitch. I really think you need somebody to oversee every step of the way through to construction. And I would offer that the Corps could do that. Now, we are expensive. We have our fees. You have to pay for our services. But I would say that, you know, you get your value back. And we can talk about that later.
Thank you very much, Colonel.
And just to like break down the numbers, the estimate for this charrette was approximately $3 million. At 15%, we're looking at $450,000 in federal funds that need to be identified to initiate the charrette through the program that was mentioned. And just for the benefit of the group, I have already contacted the Department of Interior and notified them that this is something that we may be interested in. If it is something that local leadership is interested in, we may be interested in identifying interior funds to make that $450,000 and even the whole $3 million a reality based on what's available. And so as that information comes to our office, I'll make sure to absolutely keep Legislatura fully informed of the availability of the resources. If we have no, I'm sorry, Speaker Tulahi, did you raise your hand? Madam Speaker.
Yes, if I could just, so that I was going to ask, the 3 million is based on what is the projected cost of the project at this point? Is it going to be more than the 700 million? Is that like a given that it's going to be higher than that amount?
Yeah, yes, ma'am. I mean, we just heard the initial thoughts of the task force yesterday, and I mean, they're looking at more than what the footprint of the current GMH is. So we're much higher than that. So I don't think we can stab at what the current cost of the final facility will be.
Okay, and then the I guess I was wondering, because you came up with a $3 million estimate for your costs, is that based on the cost of the project, right? Total cost?
Yeah, I'll turn it to Don to describe the breakdown. I think that's a great question.
Yes, it is based on the cost of the project, the magnitude of the project, and the kinds of people that we need to bring in and the level of effort. Yeah, so basically, yes, it's we're looking at the magnitude of the project, and that's typically what we would be seeing.
Okay, so no estimates at this point whether how much more than the 700 million or what type of cost we're looking at? Nothing, no estimate right now.
It's actually it's premature to look at that
Okay.
Because you know what you want to do is you want to bring everybody together and find out really what you need. And
I
if
have no objection to that. Just wanted to make sure whether there's a number on the table or not. And then what about so the DOI potential grant funding for the Army Corps' work? If I understand correctly, Congressman, you've said that this may come from the current DOI grants And does that impact current uses of those DOI funds? And is this, or are we going to be able to get additional DOI funds for that?
Well, that would entirely depend on what a legislatura would like me to do. If we would like to identify existing funding to be able to get this off the ground as soon as possible, then that would, of course, require a commitment of grant funds that may have been committed to something else, whatever that something else might have been. If we're looking at trying to identify additional funding sources, we are going to have to increase the funding to DOI for this particular purpose. That would add quite some time, because then we'd be talking about having to enact legislation to provide additional funds. But from what I understand, Department of Interior does have quite an arsenal of available grants that are applicable to these kind of projects. And then there are other federal funding sources that we can probably help to identify.
All right. Well, I want to thank all of you for the presentation. I think it's an excellent opportunity for us to gain more knowledge and understanding of how we can proceed with this new hospital that we all want. So I'm very grateful for this opportunity.
Thank you, Madam Speaker. And having concluded the senators, I do want to, of course, get to our community partners and our media. And so if we can expedite and just get one question in maybe from each, that way we give everybody an opportunity here. But I would like to begin by first extending this to the Guam Memorial Hospital officials, the administrator, if you had any questions or any particular input you wanted to contribute at this time. Does GMH have any questions or input? Just go ahead and say yes or no. No? Okay, thank you so much. At this time, I'd like to turn it over to our community partners. Any member of the public who is on the call that is not media, particularly our members of the Guam Chamber, if you have any particular questions. I'm sorry, before that, let me pause and extend to our other administration official, First Lady Joanne Camacho from the Guam Economic Development Authority, if you had any questions or comments, ma'am. None from Gita. All right, let's go ahead and turn it over to the Guam Chamber. Kathy, any of your folks have any questions for our Army Corps guests?
No questions, Congressman, but I just wanted to say thank you so much for the opportunity to participate in your forum. So we appreciate you and the Lieutenant Colonel. Thank you so much.
Thank you so much, Kathy. I don't think that we have any other community stakeholder organizations. And if I'm wrong, please just jump on and wave your hand. Any other members of the chamber had any particular questions? I see Kim's screen popped up there. Kim? You're good? Okay, let me go ahead and turn it over to our media partners. I know there might be a number of questions from them. We'll take it on a first come, first served basis. And Tanelta, let me turn it over to you so I don't get in any trouble from our media partners for getting the order mixed up. You're on, Tanelta.
Thank you so much, Congressman. We will now recognize our media partners. And I have names popping up, and I will go ahead and recognize Ms. Maureen Maratita.
Good afternoon, everybody. Thank you for the opportunity. I'd like to recognize my Chamber of Commerce board colleagues, but I'm actually speaking today on behalf of the Marianas Business Journal. So I have a question for the Army Corps folks. I'm assuming that the Army Corps of Engineers has experience, well, I think we've heard you have experience in building hospitals and in a variety of communities and situations. So do you take a holistic look? We have 3 hospitals on Guam. One of them is military, 2 are in what we call the civilian community, local community. We also need, it's been said over the years, facility for our veterans. not only in Guam, but the region. So are those factors that you take into account when you oversee our planning?
Thank you for your question, Maureen. And yes, the answer is yes, we do. It's part of the development of the need that the architecture engineering firm will take into account, and also the center of expertise, they come in and they help as well. So it is absolutely part of determining what the need of the community is by accounting for the existing healthcare facilities that are in place.
Okay, could you elaborate a little bit? I mean, would you say that the Veterans Clinic should be considered at the same time as the other facilities? Or would you say that could possibly wait?
Well, ma'am, I don't think I could at this time. I think I'd want to, I'd like to see the demographics, for instance. I think that's what the team would pull out as part of the charrette. They would do forecast modeling, looking at the age of your population and where they might be in terms of the care they might need in later stages of life versus if they're a younger population. I think that's the kind of research that would go into developing this. And from what I understood from the task force meeting we had yesterday, a lot of that has been done through some research already, some consulting groups. So we won't be starting from scratch. We'll absolutely be taking into account the research done already to help inform.
So you would, just to clarify, I mean, you would know things like, build-ups in particular areas tend to bring retirees from the military who stay where they've been working, right? So there has been, even for Guam, projected growth from military build-up just because of social factors like that, correct?
That's exactly right, man. Exactly right. And the compact states, great. So it's not just for Guam, it's the surrounding, entire Oceania that could benefit from a hospital of this scale. Thanks.
Okay, thank you very much.
Thank you, Maureen. I will now recognize Nestor Lecanto from KUAM News.
Thank you, Congressman, and thank you to the members of the Army Corps for the opportunity. I have actually a two-part question. As you know, the proposal by the Leon Guerrero administration is to build a medical center of excellence. Will that be one of the considerations in the charrette process as to whether a medical center of excellence, which incorporates public health and the Department of Mental Health, be preferable over a single hospital facility? Will that be one of the considerations?
Sir, I don't know at this time. I've not, when I had that letter of request, then maybe it would specify that the intent to become a medical center of excellence. At this point, I've not heard that. I have heard the task force describe 4 main components, or maybe pillars that they want to see in this campus: acute care, or same thing as a hospital, public health, mental health, behavioral mental health, and veterans affairs. So they didn't put one priority over the other. And so in the term medical center of excellence, I have not heard. I think if I would need to know what that word means and have that spelled out, and that we would shape the charrette accordingly.
Yeah, well, that was, yeah, exactly. Because there is the idea that replacing GMH with a new GMH, or building this medical center of excellence, which would include all of those facilities that you just laid out. So would the charrette consider which would be the better option?
Go ahead, Don.
Sir, hey, this is Don. One of the charrette is not a single road to a destination. What we always do is we look at options, and we're going to be looking at what is it that our goal is, and we'll be providing different options on how to get there. And those are explored and discussed, and you end up with, by consensus, this is the preferred option. And that option could be a campus, or it could be that really what we want to do is bring everything under one roof. But we don't presume at this point to know what's going to turn out. But we want to make sure that we, we don't close any doors, that we leave everything open so it all comes out on the table, and the best ideas are the ones that come to the top.
Thank you. That answers the question. And the second part of the question is, typically in your experience, when a charrette is completed and you do come up with this final recommendation in a municipal project, such as a civilian hospital, is that pretty much what will be followed through to completion? In other words, and I guess what I'm really asking, it won't be subject to political whim, for example, if the legislative leadership changes, the governor's leadership changes before, the end of the project or after the charrette is completed and accepted?
Well,
in your experience.
My experience is really with military, and in military, we do find that there are changes in administration, changes in priorities. A project will advance quickly, or it may be deferred. And I suspect it's the same with in the civilian sector as well, that other priorities happen and changes happen, but usually those things happen before you do your design. That basically there's three basic components. There's the planning, which we're referring to as the charrette. There's the actual design, and then there's the construction. So at any time there could be a change, and it could be very disruptive. But once you get into design, and you've identified what it is that you're going to be doing, and that the architect engineers move fairly fast to put pen to paper and get everything down there, and that's the ball is rolling pretty hard in a direction at that point. I'm not sure I really hit the question.
I could offer a little bit more. I've seen in my experience, short experience with the Corps, that the Corps serves as a bit of a stabilizing spine for organizations that see the kind of churn that Don described in the military, where commanders change out every couple of years, or maybe in the political sphere where there's elected officials that change out. The Corps, because we aren't moving and we own the process, and we tend to kind of want to move the project forward. Very, very much focused on turning dirt and cutting that ribbon at the end. We tend to be a bit of a stabilizing spine. Now that's not always the case, but that's one benefit you get with the Corps of Engineers.
Thank you very much. Appreciate your time. Appreciate the opportunity.
Thank you, Nestor. I'd like to now recognize John O'Connor with the Guam Daily Post. You are recognized.
Thank you, everyone. I just wanted to have you guys recap the formal funding requirements. We heard from the governor that she does want to, or she will send a formal request for engagement with the U.S. Army Corps of Engineers at some point. When you went over that formal request requirement, it sounded like there is a requirement for a pledge of funding. Can you just clarify what goes into that formal request again?
I'm gonna offer this to Rhiannon. She knows the process very well.
I'm not hearing Rhiannon. Colonel, I believe you need to unmute your, thank you.
Okay. I wanted to clarify your question. Are you asking what is needed to initiate the request for our assistance? Or are you asking what is needed to obtain the funding to get our assistance?
To initiate the request for your assistance.
Okay, so there's two routes. If the government of Guam wants to work with us directly, then we would need a letter of request stating the need, how the Corps has a unique skill set that is helpful in this case, and that you want our help under interagency and international support services. And that letter of request is then used for us to initiate our process. We would need to sign a memorandum of agreement with the government of Guam, which would allow us to undertake the work that is necessary, and that could be fairly broad. If you want to use the existing memorandum of agreement that we have with the Office of Insular Affairs, then the government of Guam would engage directly with the Office of Insular Affairs and would likely send their letter to them. And then OIA would reach out to us under our existing memorandum of agreement to set up a work agreement and transfer funds. So those are the two options.
And I guess I should ask you to clarify where does funding fall into place for this?
Right, the funds have to be available at the inception of the memorandum of agreement or when OIA reaches out to us, whichever is appropriate. And Don may want to clarify.
Okay, yeah. The one thing to engage us, funding is needed for labor. So for example, our labor would need to be funded up front. And if we're gonna do a charrette, that would involve a contract. So the funding for the contract would need to be available so we could award the contract. So, not the entire cost for the entire project. For example, maybe $750 million. We're talking about the $2.5 to $3 million to do the charrette. That would have to be available right at the beginning so we could obligate it and bring in out everybody that's needed to be brought in. Did
Okay.
I get?
Yeah, I think I understand. Thank you.
Okay.
Thank you so much, John. I'll go ahead and do a last call to all our media partners to see if we have any more questions. I see one hand up. I will go ahead and recognize Ms. Marvick.
Hi, my name is Marvick from Pacific Island Times. I only have one question. Will the Army Corps of Engineers be involved in the actual construction process, or if not, what will be the extent of your involvement?
Ma'am, that would be a great question. It's dependent on the request. I think at this point, you can specify that you would just like the Corps to assist with the planning of a hospital, and it could stop there. The memorandum of agreement could just take us up through that stage, and then we could enter into a new MOA to go past that. Or you could, you think we were pretty good at this job and have confidence that we might be helpful throughout the entire project, and you could write the memorandum of agreement with the Corps to be broad enough to include us through the whole thing. I do advocate for the strength of our team, particularly, well, at every step really, but particularly in construction. As I toured the facility just 2 days ago, actually, just on the outside, I noticed things that I just think if you had the correct construction oversight from a unbiased agent to assist you, I think you could make a lot of field corrections that would give you a better product. So that's just an example of how the Corps can assist in the construction phase. But we would do the same thing during design and during planning, as we've been trying to say.
Thank you. I have no further questions.
Thank you. I will now recognize Danielle Baza with Candid News.
Hi. So I just had a question. Does the charrette, when the government of Guam employs the charrette, do you have anything to do with the bids for building and construction, or does that fall under someone else? Does the government of Guam make those decisions?
No, that would be part of our value proposition to you is that when you bring us in to do the planning, we would use our own contract vehicles or instruments to get the right architectural engineering firm to support us through that phase. And again, that's just the charrette or the planning phase. When we pivot to the design, that would be a separate acquisition. And again, if you chose to come with us, we would use our contract vehicles to canvas, the best in the business to get, to support Guam.
Thank you.
Thank you, Danielle. I will now recognize PNC Digital.
Yes, aside from the hospital, is the Army Corps involved in in other infrastructure issues here on Guam, like flood mitigations, for instance?
I'm proud to say that we are. It's a big reason why I'm out here this week. We have also not only in the realm of civil works, civil and public works and flood mitigation, we have watershed assessments going on, which are really exciting studies to determine the overarching effect of things like climate change to your watershed. A very broad study that you can get a lot of mileage out of. We also do a lot of, as I mentioned earlier, environmental cleanup. So Area 101 is how I refer to it. It's about over 800 acres of work, and we're going to start a remedial investigation to clean up UXO. And just one example of several that we have going on here in Guam. Oh, but
Yes,
we don't do military programs in Guam. Normally, the Navy or NAVFAC handles most of the military programs in Guam.
Yes, sir. And also worldwide, there is a trend towards building more micro hospitals rather than the big hospitals that we're familiar with. And there's a school of thought here on Guam that they're saying that instead of building one big new hospital, that there could be several micro hospitals. Does the Army Corps have experience in building those kinds of micro hospitals?
So I'll start by saying yes, maybe not micro hospital, but clinics. We just finished a world-class clinic on Schofield Barracks in Hawaii. I really, if you were traveling through Hawaii and you'd like to see what my district can do in terms of healthcare, you've got to see the behavioral health and dental clinic at Schofield Barracks. It's what you're describing as a smaller, distributed type of healthcare kind of facility. And it's state of the art. It's really impressive. But I think Don could speak a little bit more to your micro hospital question.
No, that covered it really. We build to the need. So if the need is distributed micro hospitals, that can be something which is addressed. It really, what's being driven is the need. Guam is a place. Let me back up in a second and say I suspect that Guam is probably not a real good candidate for that, but it would be something to be looked at because of the size that you have, the transportation to, from end to end of the island. There's a certain benefit to co-locating a lot of expertise and in one location, which is not that far away. When you get really spread out over a large area, micro hospitals can start to make a lot more sense. And again, depending on the need and demographics and what you're trying to serve.
And one last question for the congressman. Congressman, the Congress recently passed that infrastructure bill, right? Can we get funding from the hospital for that, or what specific benefits do we get from that infrastructure bill?
That's a very good question. I am proud to announce that everything that we mentioned in my congressional address is in the current infrastructure bill, including the multi-billion dollars in program grants that we can apply for on a discretionary basis for public transportation. We did secure the $20 million for our bus shelters, and we did secure the increase of our highway fund from 15 million to 45 million annually. Unfortunately, I came across this charrette information in my recent trip to Hawaii to meet with our Army Corps colleagues. And so that was just not the timely window for me to be able to add that language into the infrastructure bill, as it was already well on its way without us being able to stick that on. So this funding round, unfortunately, does not have any funding in the infrastructure bill for a charrette, but I am confident that we are able to identify the necessary funding within the Department of Interior, and we're working with them to be able to do that.
Okay, no further questions. Thank you.
Thank you very much. We are now going to proceed to the second round of our questions, and I'm going to go ahead and recognize Maureen one more time.
Thank you. So to the U.S. Army Corps of Engineers. So you saw Guam Memorial Hospital and the condition that it's in, basically. And there've been so many efforts to repair it and find the funding that were unsuccessful. So if we build a new hospital, would you recommend design build or design build maintain as an option?
Ma'am, I did not come prepared with that kind of an answer. I think it's a very astute question. See, Don, do we have a standard answer for something like that?
Well, again, that is something that can be evaluated during that planning process of what, what are the pros and cons of design build, design bid build, or even design through maintenance. There's pros and cons. The design build sounds like it's better because you can go faster, but sometimes what that means is you have to figure out all the questions before you award that contract, or you're going to get stuck with a lot of change orders. So sometimes it doesn't sound so good. Design bid build takes a long time, but sometimes it takes less time because you have less changes and you don't have to go back for money so often for some of the changes. The design through maintain, what that does is it gives the designer constructor an incentive to build with higher quality stuff because they know that they're going to have to maintain it. But it may not work quite as well with medical as it does for a lot of other facilities, because medical, almost the year after you finish the building, there's new stuff that's coming in. Different equipment is going to be brought in. There's changes in configuration, and it's a constant change, and that can make the design build maintain, where you're kind of sole sourcing it to one company for a very long period of time. It can make that less attractive, but it's something that needs to be looked at. There's no easy answer. Sorry, that was a long answer.
That's okay. And I mean, USAC has so many years of relationship with this region. It doesn't necessarily mean that that it would be one and done for the hospital, right? I mean, you could come back and I want to say keep an eye on it, but work with the government again, or the congressman, or our leaders to ensure that that it stays the best it can be, really, right?
Yes, ma'am. I can say that's for sure. I mean, that's absolutely the ethic that we bring to it. We do not want this to be we want this to be something we're proud of. As a matter of fact, when the congressman first brought this to me, I'll be honest, I personally have not built a hospital in the first world. I've been deployed and built hospitals elsewhere. And I was a bit nervous, and I talked to my headquarters to say, is this something that the Corps of Engineers is willing to take on? Because this is not just a planning charrette. It's not just this is not just a key leader engagement. This is our brand that's on the line here. So we bring that ethic in every engagement we come to. I was sure when I decided to meet again on this topic that I was going to be able to commit. If you wanted, that I was going to be able to commit and deliver value for the long term. Hospitals are hard though, and they are not the easiest. They're not among the kind of run-of-the-mill projects that the Corps takes on. They're fraught with challenges. So when I equivocated, and you heard Don's answer too about acquisition strategy, it's because this is an art and science for us. We take it very seriously, and we'll think deeply about what is the right acquisition strategy to guarantee value and quality at the point of construction complete, as well as 20 years down the road when maintenance starts to become a bear. That's where our heads are as engineers on a project like this.
Okay, thank you very much.
Thank you, Maureen. I'm going to go ahead and now recognize Nestor for his follow-up question.
Thank you. Appreciate the opportunity. I have one question that's not related to the hospital, but it is related to one of the primary missions of the Corps, which is ecosystem restoration and environmental stewardship, which I think the Colonel mentioned earlier. I wanted to draw your attention to a major incident that happened a couple of weeks ago involving a contractor that is building a solar farm in the northern Guam village of Manilao. Apparently, they were cited by Guam EPA, and I believe US EPA is also now involved for failing to live up to their mitigation plan. And they allowed a large amount of sediment to run into a pristine recreation and cultural site that we call Marbo Caves, which is a freshwater site that's very picturesque site. And so is there something that the Army Corps can do to assist with this? And can you make a general comment about incidents such as this? Thank you.
Sir, just to clarify your question, you asking if we can assist with this specific problem that you're facing with the solar field? By the way, I did hear about it. It's a tragedy.
Yeah, if you were to be engaged, how would that occur, and would you be able to do it?
Sir, I'll have to take that one back to the team. I mean, it's a very unusual situation. It's a private company, private land, I believe. I'm not sure how you can engage us for that. I believe there might be something within our regulatory program where we control waters of the United States or regulate waters of the United States. And it sounds like what we have here is a deficiency there where there was runoff, significant runoff. So I have the issue. I'm going to take it back and see if we have jurisdiction over it.
All right, thank you. No more questions, thanks.
Thank you, Nestor. Thank you, Lieutenant Colonel. We are going to now, I believe that concludes the media portion and media inquiries. And we did have a question come in from Speaker Terlahi. I'll go ahead and read it out or recognize her if she'd like to pose the question.
Yeah, I think it was answered earlier when they gave what the steps are going to be. So thank you. I understand now.
Thank you, Speaker. We wanted to make sure that that was clarified for you. Thank you. At this time, that does conclude our questions portion. So I'll go ahead and now recognize Lieutenant Colonel for your closing remarks.
Thanks for all these questions. It really is an honor to speak to this audience, all you ladies and gentlemen who are interested in the health of your community. The fact that considering the Corps of Engineers as a partner in that is very special to me. It's a high honor that I have. I thank you all for your service as a citizen as well. I realize it's these hard decisions that were made many years before I ever came around that put hospitals in the ground, that took care of me when I was needed care for. And that's what we're doing right here. I see how hard it is. I see the massive amount of thought and planning and funding that's required. So I just thank you for your service and for allowing us to kind of tell what role we could have here in Guam. I look forward to more meetings in the future if you choose to work with us.
Thank you very much, and thank you all very much. I'm going to go ahead and recognize Congressman Nicholas for his final closing remarks.
Well, thank you, Tanelta, for your excellent moderation. I'd like to thank our media partners for spending the time with us and for asking their very thorough questions and for making their platforms available to their listening audience. I'd like to thank the administration officials for being present and being informed, not only of the additional information that they maybe have been able to glean from our Army Corps guests, but also from the questions from our elected lawmakers who asked a lot of very, very good questions that shows that they're thinking very deeply about how to effectively engage a project of such scope, magnitude, and cost. And I think that in and of itself, witnessing how deliberative our legislature is being on this is in and of itself reassuring to our community that we're going to do everything we can to get this right. I'd like to thank our community partners as well, the Guam Chamber, for being present. I know that they take an interest and will, of course, share this information with their memberships. And last but not least, I would like to thank the Army Corps of Engineers for a phenomenal presentation. Colonel, the work that you guys have done today and the information that you've shared and the frank conversations and upfront answers were exactly what the people of Guam needed to hear today. They're exactly what our leaders needed to hear in order to be able to make informed decisions. And I would just like to say that this was just an excellent experience. And, you know, if you talk about putting the Army Corps reputation on the line, I think that you guys came and brought your A game. So thank you so much for a very, very excellent time. And I do know that we're going to be spending the rest of the afternoon touring some concern areas. We're going to be going down to the witness some agate flooding concerns, the Umatic Bridge, and some of the Maritzo flooding concerns as well, just to be able to give you guys a very upfront view of what's going on down there. But with that, we're going to go ahead and conclude. If any members of Legislatura wanted to make any remarks, of course, I will go ahead and yield at this time. I know that you're still present and you guys have spent a better part of your lunch hour with us. Thank you very much. If any of our senators had any remarks.
Well, if I could just say again, thank you to everyone. I think the presentation has really provided us with information that we need. It's very timely. So I'm very glad, Congressman, for the timing of this. And of course, I was present when the Army Corps gave their assessment of the hospital last, or 2019. And so very important, I think, that we proceed with as much information as possible. And I can't stress that enough. So Sidus Maasi to all of you, and good luck on the rest of your tour on Guam. The flooding really is an issue that I'm hoping that we can address with your assistance, that we know you are involved in that. So Sidus Maasi, take care.
And without further ado, we'll go ahead and conclude. Thank you all very much for making your time available today. Sidus Maasi. Be safe.
Thank you, everyone.
Thank you.